Hi, and welcome to the Banfield Pet Academy. My name is Dr. Carl Winch, and I'm a veterinarian with Banfield Pet Hospital. Today, I'd like to work through a case study with you. This one involves Max. Max is a dog. Now, Max's owner brings Max in because she notices that he's just not feeling well. He's not acting himself. He's not really eating as much. And his face looks different. And his breath is really bad. So what do we want to do first? Well, the first thing we're going to do is we're going to do that physical exam. We're going to go from nose to tail and see if we can find out if there's anything wrong there. We're going to take his TPR and we're going to have a good feel over him as well. Now, as we're doing this, we may be asking some questions. What are some things that maybe we'd like to know from the owner? What kind of food does he normally eat? Is he drinking water more or less often? What are his bathroom habits like? Are there any fun things he likes to chew on? Rocks, sticks, bones? Any toys missing in the house? Or anything that could have happened that he could have gotten into or had an accident. Now on our exam, we're looking in his mouth and we see that he has a chipped tooth. Now that chipped tooth, maybe nothing, but we find that 70% of problems are below the gum line where we can't actually see. And then we're looking at this tooth, the gums are all red and swollen, so it looks pretty angry. What do you think we should do next? Should we put him under anesthesia and take an x-ray of that tooth? Should we have the owner just keep an eye on things and see if it gets better? Should we prep for emergency surgery? Or do we just prescribe some soft food for Max and hope that things get better on their own? Right, we need to find some more information. So we're going to get permission from Max's owner. We're going to put Max under anesthesia. Now this anesthesia is going to be figured out by his weight, calculating the drug doses, managing his pain, and prepping the surgery suite. So once we've got all this set up, we've got all this done, we've got Max under anesthesia, we're going to take an x-ray of this tooth. Now I have to say, we find that this tooth is pretty broken below the gum line, so it needs to come out. But don't worry, we're well experienced in that. We take the tooth out, we suture up the gums, we send him home with his pain relief, and Max is back to normal within a few days. It's amazing how pain can cause changes in behavior. And that's just one thing we look out for. Owners may notice different things that tell them that their pets are unwell. Changes in appetite, changes in behavior, even how they look. Going forward, we don't want to just take this tooth out and have that be the end of it. We also want to talk to the owner about dental care. We want to talk to them about things like doggy toothbrushes and doggy toothpaste. Because it's important to use dog toothpaste, not a human toothpaste, because dogs can't take the fluoride. But brushing our teeth on a daily basis helps to keep those teeth nice and healthy. And help keep them strong so that they don't break as easily. And being careful of what they chew on as well. Sometimes hard toys can cause their teeth to break. So to review, Max came in, swollen face, not feeling well, owner worried. We did our physical exam. We found a problem. We then investigated that further with the x-ray of the tooth. Found that the tooth was broken, fixed that problem, and now Max is well on his way to recovery. Well, thank you for joining me today. I look forward to seeing you next time at the Banfield Pet Academy.